everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the September 14th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County's case total today is 2,404, which is 175 more COVID-19 cases since my last report 1 week ago on Tuesday, September 8th to the City Council. I am sad to report we experienced an additional death last week, so the total number of COVID-19 deaths is now 37 for Dubuque County. 9% of the over 26,000 people tested in Dubuque County have been positive overall since March. The 14-day average positivity rate is 11%. On September 8th, the 14-day average positivity rate was 9.4%. As of September 12th, 16 Dubuque County individuals are currently hospitalized in Dubuque County, and 79% of Dubuque County positive cases have recovered to date. The state added 4,032 cases since September 8th, 2020. As of September 14th, 2020 at 2 p.m., Iowa has a total of 74,897 positive cases. In all, about 1 in 4 Iowans, or over 700,000 people, have been tested, and just over 10.6% of Iowans tested have been positive. Yesterday's state 14-day average positivity rate was 8.8 for the whole state. Deaths reported in the state total 1,223 Iowans. Currently, 272 cases are hospitalized throughout the state, and finally, about 73% of Iowans have recovered. So it's no secret our cases here in Dubuque County keep increasing. The 14-day trend line and positivity rate have both been increasing for about 2 weeks. We know that schools starting and colleges and university students returning have impacted our number of cases, but that's not the only people turning up positive. Events over Labor Day weekend and other community events, weddings, and other social gatherings happening locally are definitely contributing to the increase in cases and spread of COVID-19 in our community. Our testing numbers reveal substantial testing occurring locally also. Dubuque County has the second highest per capita testing rate among counties and cities over 50,000 population. 2 weeks ago, we had the highest rate of testing among these counties. Related to increased cases locally, it's also happening on a state and national level. Last week, the CDC reported on 2 of their studies documenting transmission in child care centers and in association with eating out in restaurants. The CDC's Morbidity and Mortality Weekly Report, also known as the MMWR, analysis of contact tracing data in Salt Lake County, Utah, identified outbreaks of COVID-19 in 3 small to large child care facilities linked to index cases in adults and associated with transmission from children to household and non-household contacts. In these 3 outbreaks, 54% of the cases linked to the facilities occurred in children. Transmission likely occurred from children with confirmed COVID-19 in a child care facility to 25% of their non-facility contacts. So this study emphasizes the importance of public health strategies in child care settings, including mask wearing, hand washing, distancing, and screening for staff and children. It also reveals that children who are positive can then transmit it to other members in their household and other settings. In another report published in the MMWR demonstrating how community and close contact exposures add to the spread of COVID-19, results showed that close contact with confirmed cases and eating out at restaurants were linked to an increased likelihood of contacting the novel virus. When other forms of exposure, such as mask wearing, shopping, reporting to an office setting, going to a salon or gym, bar, coffee shop, or church or religious gathering, along with using public transportation, when all those were accounted for, 42% of the positive cases had close contact with confirmed cases in the 2 weeks prior to testing, compared with 4% among a control group of adults with negative tests. The researchers also found adults with positive SARS-CoV-2 test results were almost twice as likely to have reported dining in a restaurant than those with negative SARS-CoV-2 results. Dining at a restaurant in this study included indoor patio and outdoor seating. Something to think about. Masks cannot be effectively worn by eating and drinking and talking during a meal, whereas while you're shopping or numerous other indoor activities, that does not require masks being removed. I'm sure all of these local and national trends do not make you feel any better about the COVID-19 pandemic situation, and they're not really meant to. Parents of school and college-age children have a constant and nagging concern, even if they're taking all the COVID precautions. I know, as a mother of children in college, I think about it all the time, especially since we're hearing reports of the lingering effects of COVID-19 disease, even after recovery. On that note, just want to say happy belated birthday to Louie. I know you don't advertise your mom works in public health, but do your best to stay safe and keep up the good, healthy habits that you do. Thanks for tuning in today, everyone, and believe it or not, we're still all in this together.